My name is Demian Glujovsky. I am the founder and director of Fertility Argentina. Fertility Argentina is the unit of international patients at CEGYR, the first clinic that did an IVF in Argentina. We've been working with international patients for more than 10 years. Nowadays we see more than 250 patients coming from abroad, especially coming from the US, Canada, Australia, and the rest of South America. There are always latest trends in medicine. In IVF, it's not easy to find the latest, but PGS, which is not latest, but there are some things that change in that specific area, is something that is more and more required. PGS is pre-implantation genetic screening or testing, now PGT. We do it in our clinic. We evaluate the embryos, the chromosomes of the embryos, and that makes, to shorten the time to pregnancy, we reduce the risk of miscarriage, and we reduce the risk of having a baby with chromosomal abnormalities. The only cons of that is that you need 2 trips. The first trip to provide the sperm and do the IVF, and then we freeze the embryos and we analyze them, and in a second trip we transfer those embryos. So that is the only thing that you have to think about. If using donor eggs and donor sperm, it is only 1 trip. And if you decide to ship the sperm, it is only 1 trip too. We provide donor sperm if necessary. So we have a donor sperm bank. So some people decide to use own sperm, of course, most. Some people prefer to ship sperm from the US, and some people use donor sperm from our sperm bank. Our sperm bank is good. We do genetic analysis, the same genetic panel as we do for egg donation. So it is also good to use our sperm bank because we can match egg donors and sperm donors according to the genetic panel. So yes, sperm donors are available too. When you come to our facility, to Fertility Argentina, you should expect a personalized service. So one of the main things is that you will be in touch with us, specifically with me, for the whole treatment. I am in charge of the patients from the beginning to the end. We have a large team, but I am the head of that team and I like to know each of my patients. So we will have 1, 2 or more contacts through video call if necessary, telephone, or just chatting on WhatsApp or email to prepare everything. And once you are in Argentina, I hope you feel that we've been in touch for a long time and we know each other to feel that you are confident with the thing that you are doing. One of the most important things for me is when you come back home to know that you feel that the process was as good or even better than what you expected to find there. The other thing is the effectiveness. We have really good effectiveness. And the reason of that is that we base all our services in the best available evidence. So if the evidence recommend to transfer from blastocyst stage, we do it. If the evidence show us that PGS, pre-implantation genetic screening, is a good option, we offer it. So we try to make it in the best way, and that is the reason why our success rates are high. So really what we try to do is to make it personalized, effective, and simple. So the trip to Argentina shouldn't be long. Usually in just 10 days, only one trip, we can make it happen. So if there is a woman or a couple that needs shorter time, we can think about that specific person and see how we can be flexible to make it happen in a shorter time. So it is just a matter of communicating, talking about the needs of the patient, taking in account the values and preferences, and then just work to make it happen in the way the patient needs. If someone wants to get in touch with us, they should write an email to info@fertilityargentina.com or directly to my email, Dr. Glujovsky, as my last name, @fertilityargentina.com. That is the easiest way to be in touch with us. Our website is www.fertilityargentina.com, so that is another way to be in touch with us. As soon as we receive that email, that contact form, we usually get in touch very soon in the first 24 to 48 hours, and we can start working together. We usually set up an online appointment, Skype, WhatsApp, or what the patient needs. And if they really want to go ahead, in 2 months, they can be in Argentina, starting with the whole thing.